Top Med Talk.
Hello, I'm Desiree Chappell, and this is Top Med Talk. We're coming to you live from the American Association of Nurse Anaesthetists 2019 Annual Congress here in Chicago, Illinois. AANA 2019 is a gathering of over 3,000 certified registered nurse anesthetists, or CRNAs, for the largest networking and educational event in nurse anesthesia. Now, this year, the AANA has partnered with Top Med Talk to bring the meeting to our listeners. So over the course of the next 3 days, we're going to be sitting down with presenters, AANA leadership, and delegates to discuss hot topics in the CRNA community and anesthesia practice in general. Now, I'm joined by my co-host and partner, editor-in-chief of Top Med Talk, Monty Mythen. Hello, Monty.
Hey, Desiree. Great to be here.
It is great to be here. The buzz is a little bit different right now.
Yeah, in the trade exhibition is a bit. This is interesting. There's a lot of action here. A lot of people flooding in. There's a bit of snacking going on, and there's a little bit of drinking going on too.
Yeah, a little bit of refreshments.
Refreshments.
We'll call it refreshments.
Rehydration.
The hydration station. They were so excited about that. So we've been doing recordings with the AANA this year, and we're kind of in our own little space, and it's nice and quiet, but it's fun to be here within the buzz of the trade exhibition.
It's great.
For sure, yes. So we've had a chance to meet up with some friends. We've met some new friends and old friends as well. And a friend of mine, Brent Denworth, who's a CRNA, the chief CRNA actually, and director of advanced practice and anesthesiology at Vanderbilt, is sitting down with us. Hi, Brent. How are you?
I'm great. Desiree, how are you? It's great to be here.
It is. I'm good. I'm good. Been crazy busy since the last time I think we touched base.
We have both been very busy running races, but good to catch up.
Yeah, I was going to say, every time anybody mentions anything about doing cool stuff around the country, your name always seems to come up. It seems like you're involved in a lot of different things.
That's very nice of you. Thank you.
And doing great work down there at Vandy.
Trying my best.
Yeah? So I just wanted to catch up with you and talk to you about some of the initiatives that you've been working on over the last couple years. And I know the Respiratory Compromise Institute was one of the ones that the initiatives that I know was kind of something that you've been recently appointed to.
Yeah, so we can sort of start there. The Respiratory Compromise Institute was looking for additional representation from other professional societies, and so I am proud to represent the American Association of Nurse Anaesthetists there, and we are looking at how we can prevent respiratory decline in the hospital by identifying it early. So a lot of it goes back to very similar studies with sepsis, for example, where sepsis was so deadly, and when early warning signs were available and used, the sepsis death rate has gone down dramatically. And so this group is working hard to try to accomplish the same thing with respiratory compromise in the hospital setting.
Oh, fantastic. What are some of the studies? Are they trying to develop studies of their own, or what other organizations are they working with?
So the RCI is really part of the National Association of Medical Directors of Respiratory Care.
Oh, impressive that you got all that out.
Yes, and I could remember it off the top of my head. And so it's a multidisciplinary group with many different physician specialties represented, nursing specialties, clinical nurse specialists, respiratory therapists. And so it's looking at what's out there currently and then sort of charting the course for the future, but trying to have deliverables that are quick for clinicians to make sort of an easy impact on this issue.
Yeah.
And Brent, is it specifically in hospital or specifically in hospital perioperative?
It's in hospital in total, yes. And so, my expertise comes from the perioperative side.
Yeah, that's great. So we should kind of keep an eye out for some of the things coming out from there, you hope, in the next year or so?
I've been very impressed. I think they put together a lot of great thought leaders, and so definitely something to keep an eye on.
Yeah, where can we get more information about that?
They're online at Respiratory Compromise Institute.
Okay, like just .com?
I think .com or .org, yes.
Yeah, okay, that's great.
Now, is using some kind of risk tool to identify at-risk patients a component of this?
There's a lot of ideas in which direction it goes, we'll see. But certainly being able to say, are we using the right technologies in the right setting, for example? Knowing that pulse oximetry will be a late indicator, right, of adequate exchange, whereas capnography would be an early indicator of that. And so that is not commonly instituted in all postoperative or other inpatient type patient settings, and perhaps it should be. And what is the best direction to go to have the knowledge and to have the early warning?
Fantastic. That's great. Well, Brent, another topic that we both have worked on here at the AANA and within our professional organization and outside of our professional organization as well is enhanced recovery. And I just wanted to touch base with you to see how things were going at Vandy and any kind of new ideas coming out of there or new projects.
Enhanced recovery at Vanderbilt has been sort of a hot topic and one that we have taken a lead on and continue to try to perfect year over year. My role as the Advanced Practice Director in Anesthesiology puts me in a unique spot to be able to work with our advanced practice nurses who staff our preoperative evaluation clinic, our advanced practice nurses who are nurse anesthetists in the operating room, and our nurse practitioners, advanced practice nurses who do our perioperative consult service and do the postoperative follow-up and rounding on patients and to really optimize them for a quick and least amount of pain discharge with comfort. And so that's been very effective, and I think it's a total package. We're also on the front end now starting to look into prehabilitation.
Yeah, I was going to ask you about that.
Yeah, and that is something that, when you think about it, you have to wonder, why is it taking us so long to realize we should be involved in this? And also high-risk surgical encounters is one of our latest endeavors to really look at patients who are very high risk for surgical procedures and really optimize them before they come in. So we're stratifying healthy, moderately unhealthy, and very high risk in terms of how we manage those patients coming in for surgery.
Oh.
So we were at the World Congress of Prehabilitation a couple of months ago, which was held in London. It was the third World Congress, I think, of prehabilitation. And one of the predictions there was that prehabilitation next year would be the word of the year, because it's become such a buzz around it now.
Yes, that would not surprise me at all. I'm fully expecting that. I think it's pretty exciting, and it's a space that we need to get into because I think we can have a huge impact on how our patients do.
And at Vandy, how's it manifesting itself at the moment? Are you starting to have exercise classes for people? Are you starting to supervise their nutritional habits?
We are, yes, we're really just getting out of the gates a little bit and having some practitioners who can see patients preoperatively and optimize anemia, who can sort of look at nutritional status and exercise status and how do we optimize. So we're just getting going. The best story, though, has been our administrative assistant in the department, and I share this because she's given me permission to do that. Her mother-in-law, who was in her late 80s, was diagnosed with colon cancer and needed a colon resection. And so she was one of our first patients to really go through the prehabilitation process, and her outcome was spectacular. She had a little bit of a rocky postoperative course, but because she had her prehabilitation, I think she otherwise may not have had the same outcome that she did. And so she's smiling and in a photo shoot for the medical center to support our work in prehabilitation, and something that really puts a smile on our face.
Yeah. Oh, that's fantastic. I know those initiatives are difficult to do and difficult to coordinate.
Yes.
But it sounds like you guys have a good team kind of put together.
Yeah, we're trying to. Just getting the resources available to do that is a challenge. But I think when you can demonstrate impact, right, and the value of that, then it becomes a much more easy sell.
Yeah, fantastic. Well, Brent, I'm excited about our session tomorrow here at the AANA. We're going to be talking about ERAS, nuts and bolts, and I just kind of break that down to like ERAS 101, right?
Yes.
Yeah. So my question to you is that when we first started talking about if we needed that session or not, there are a lot of people that said they did not. I think we've moved on from ERAS 101. Do you believe that or no?
No. I think that a lot of people have moved on from ERAS 101, but as I go across the country and talk to different people, I realize there's a whole lot of people that are still looking for the initial recipe and how they get started in their practice. And practices are so variable. It might be a very small community hospital, and practitioners would say, well, what would I do? Because I certainly can't conduct rounds on all of these patients. And there are ways that you can start. You don't have to be all in, but there's an impact from even small efforts toward enhanced recovery. And other places are bigger operations, and they can do a little bit more with more resources. But I think the 101, we're still getting to the appropriate audience, and I think that we're serving our colleagues well.
Yeah, I think so too. I'm excited to move, because a lot of people, when I go around and talk to, especially CRNAs, but anesthesia community in general, kind of focus on enhanced recovery just being pain management. And it's so much more than that, even in the OR.
So much more.
Yeah.
Yes.
And so I'm excited to kind of expand and talk a little bit more about that.
And I think when people realize the patient outcomes and go and visit their patients and see the night and day difference that enhanced recovery protocols can bring, they really become a doctor.
Yeah, absolutely. Well, Brent, thank you so much for sitting down with us and catching up. I always love our chats and to hear what you're doing. It's such a thought leader within the anesthesia community and CRNA community. So thank you for everything that you do, and look forward to our sessions tomorrow.
Thank you for having me, and I do look forward to tomorrow.
Yeah.
Take care.
Right. Cheers.
Bye-bye.
Top Med Talk.
Nate Majerison here. Thanks for listening to Top Med Talk. Now, before we let you go, it's important that we remind you to subscribe to Top Med Talk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out topmedtalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. topmedtalk.com, and click on the section marked email updates. Finally, Top Med Talk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on Top Med Talk. That's ebpom.org/meetings.